Our chief guest today, Dr. Mose Mongangi, CAS, Minister of Health, Dr. Pacifica Onyancha, the Acting Director for Medical Services, Preventive and Promote Health, representing the Acting Director General for Health, Dr. Amoth, Madam Luce Kimondo, representing the Director General for National Council for Population Development, Dr. Sheikh Mohammed, Dr. Isaac Bashir, the Head of Department of Family Health at MOH, Dr. Karo Ngunu, representing Director Health Services, Nairobi Metropolitan Services, Dr. Josephine Kibaru Bae, other senior government officials present, Dr. Aziz, representing UNFPA's, Dr. Ademolo Lajide, all our partners, including PSK, PSI, and the rest. Ladies and gentlemen, this morning we gather here to mark the World Contraceptive Day, which is marked on 26th September of every year. But before we get into the details of the day, our chief guest, allow me to invite Ms. Koronya to lead us in a word of prayer. Then after that, we are going to be led with the national anthem and then the East African anthem. Then we peek into the program. Thank you.
Good morning, everyone. Let's stand up and pray, please. Let us pray. Our Heavenly Father, we thank you for giving us this day. We glorify your name, Father, for protecting us to be here. We thank you, Lord, even for supporting us with the resources, Lord, to be able to support our country. We ask you that whatever we are going to discuss, Father, you are going to give us wisdom and the skills to implement. In Jesus' name we pray and trust.
Thank you. Thank you. Our chief guest, I request we remain upstanding as we play the national anthem and the East African anthem. Thank you.
Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu. Uzalendo pia mshikamano viwe msingi wa umoja wetu, na tulinde uhuru na amani, mila zetu na desturi zetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
Thank you. We may now be seated. Our chief guest. Our chief guest, moving into our program, I would want to notify ourselves who are here that this program is running live on KTN Home. We also have our Twitter handles and our Facebook pages where this program is going live. So those who will be able to send out tweets and Facebook messages, kindly the hashtags will be displayed on the screens that are there, so you may do the necessary. Our chief guest, at this moment in time, allow me to invite Dr. Isaac Bashir, the head of Department for Family Health, to give us some few welcome remarks and also get us into the theme of the day. Dr. Bashir, thank you.
Thank you very much. Our chief guest, Minister of Health, Dr. Mercy Mwangangi, Dr. Pacifica Onyancha, our Director for Preventive and Promotive Health, representing also our DG, the Acting Director for Health, Lucy Kimondo, representing Director NCPD, Dr. Carol Rungunu, also representing Director Health Services, Nairobi Metropolitan Services, Dr. Aziz Geldi, the Deputy UN Representative for Unfpa, representing Dr. Adimola, the UN Rep, all guests and members of Ministry of Health and members of the Fourth Estate, good morning. Mine is very short. It's just to welcome you and to appreciate being a weekend for all of you to find time to assemble here to steer this national agenda of family planning and celebrating the World Contraception Day. This is a global day. We are going to have details by different speakers. Mine is to thank you as partners. It has been a tedious month for the planning team, who have been meeting initially on weekly basis and later on daily basis and sometimes twice in a day. This is the fruits of your labor, and we are celebrating this World Day here in Kenya. We appreciate the partnership that we have on this agenda. This is not only a government agenda, it is all Kenyan agenda. Because family planning is the cornerstone for development. And as a nation, we have identified that, picked it, and it is one of the global commitments, whether it is through MDGs or SDGs and our National Vision 2030 agenda. There are different government arms. I wish to appreciate NCPD as our advocacy mouthpiece for this agenda. And the Ministry of Health is the service delivery arm of family planning. And these two are like Siamese twins in the government. And since they are also very close to Treasury and they come from Ministry of Planning, we need to be very close to them so that they can talk to the powers to be who decide on where the dollar goes. I don't want to delve into the benefits of family planning. I know there are many speakers after me. Mine is to just say that our theme for today, for this year, is actually to increase domestic resources, ensure that come 2023-24, our commitment with our partners is that we will be a nation that can stand on its feet and can be able to procure and ensure that we buy our family planning commodities holistically and wholly from GOK funding. We have an agreement with our partners. They have been working with us. Sometimes 90% of our budget comes from partners, but this year and last year we've met our commitment, and we want to continue living up to our commitment with our partners. Come 2023-24, we have agreed with our partners that they can invest in other programmatic issues, but not commodities for family planning. And Madam Cass, Mercy, this is where we need your support at higher level. We are doing what we can do at the MTEF and at budgeting level. But when it comes to sharing the cake, we want you to be on our side, next to our shoulder, and helping us make that a reality. The family planning budget is not simple. It's about 2 billion. And we are thankful to our partners. USAID, UKAID, Unfpa have been very supportive. And this year, we have met our forecasted and quantified amount of the commodities. And the government has also surpassed its bit of commitment. So we are doing the MTF now. We have put some figures there. Those figures need to be defended when the right time comes. So with those few remarks, mine is to welcome you and to immensely appreciate on behalf of the Ministry of Health and on behalf of the department that we appreciate your support and your partnership in this. Let us walk this together. The issues of COVID have brought up issues of teenage pregnancy, and that is something that we can prevent with this contraception for family planning, a robust family planning program. We've made quite gains in the last few years, and we are proudly leading the region, and we don't want to allow COVID to make us lose the gains. So we need to revamp the lost gains during these few months so that we cover up and meet our targets in terms of the CPR, the modern CPR, and in terms of reducing unmet need. The teenage pregnancy has come because of huge unmet need in adolescents and at that age of our youth. And it is important to remember that 70% of our youth, our population is youth. And that is where we need to focus. They are the engine of this nation if we are to spur any development. Let me not take long in my welcome remarks. I wish to thank all of you guys and for coming and to celebrate this day with us. And I hope we will have a very fruitful deliberations and speeches from our leaders. Thank you very much.
Thank you very much, Dr. Bashir. Now, our chief guest, as Dr. Bashir has mentioned, this event was made successful by the very many partners that we had on board. And at this point in time, allow me to invite Peter Mildred to speak on behalf of the partners. Thank you.
Good morning, all. Dr. Mercy Mwangangi, CAS Ministry of Health. For all others, please allow me to stand on existing protocols so that I don't do a faux pas for a name that I may pronounce wrongly. Thank you. It is my pleasure to be here today. My name is Mildred Peter. I am the head of the Global Healthcare Programs and Sustainability for Middle Africa at Bayer. Bayer has always been and will always be a partner next to the government of Kenya, next to the people of Africa. As you would remember last year at the Nairobi summit, we committed to reaching 100 million women, giving access to 100 million women in low and middle income countries, of which Africa would play a very major role between now and 2030. Our role and our place near your government, ma'am, is as a partner that is here to support you as you move the agenda for family planning and women's health in general in your country. Our commitment is not only as a manufacturer, but that on this journey that we become a trusted advisor, that we're at your side to support programs, that we are relevant within this ecosystem, and that the people of Kenya know that they have the support of our company, and that we make sure that Kenya remains a priority country in whatever we do. I want to thank Dr. Bashir and his team for giving us this opportunity to be part of you, to be partners with you, and to continue this journey with you as you move the curve forward for Kenya. I want to thank you once again for making us part of this discussion. And as we always say, happy World Contraception Day. Thank you very much.
Thank you, Peter, for those brief and educative remarks. At this point in time now, allow me to invite Dr. Josephine Bio from DFID to make some brief remarks moving forward. Thank you.
The chief guest, the administrative secretary, Ministry of Health, all the government, senior government officials here, all the development partners represented, the members of the fourth estate, ladies and gentlemen, it's my pleasure to really be part of this team today as we commemorate the World Contraception Day, and just to believe that we are here for a common reason. We are all supporting the women and girls to make sure that they are accessing family planning when they need it. Not when we decide for them, but when they need it. And when we talk about women and girls, we remember also our adolescents in that box, because we know that we have a lot of mothers, 15 to 19 years, who have no access to these contraceptives. We cannot overlook the fact that when we don't have good coverage of family planning, maternal deaths are higher, infant mortalities are higher, and child survival is a problem because the mothers are giving birth too frequently. They're not able to take care of their children. And this is very clear in our data. We can see, for example, in Kenya, all our counties that have below 45% of coverage for modern contraception, they are still the highest contributors of some of those indicators when it comes to maternal deaths and infant deaths. And there's also a very close correlation between that and poverty. So if we want to address poverty, we want to look at economic issues, we cannot have that conversation without putting family planning, contraception discussions on the table. I know Dr. Bashir has mentioned about the global need for contraception, the unmet needs of over 200 million women globally. And we also know that as of about January this year, some statistics were showing that globally we have almost 21 million adolescents, 15 to 19, getting pregnant. That still tells you there's a big gap, and our country falls in there to see what we can do to address that gap. I'm happy to say that it is clear that Kenya has been addressing this in a very consistent manner. And we can see also in our policies, for example, the Kenya National Health Policy 2012 to 2030 clearly brings in the key obligations of the health sector, and one of them is looking at the health through the human rights-based approach and also ensuring access to services. So this is a clear commitment that the government is doing something. And just to add on that is actually to acknowledge the theme for the World Contraception Day today: sustaining family planning services, even in the challenges we are having like the COVID, and also marching towards sustainable domestic financing. For me, that is really huge and a demonstration of huge commitment by the government to address the issue of reproductive health. So as they mentioned, I'm here on behalf of I'm making these remarks on behalf of UK Aid, but I work for a program also funded and supported by UK Aid called DESIP, which means delivering equitable and sustainable family planning increases in Kenya, and it is supporting 19 counties that are below 45% of uptake of family planning. And so maybe just to mention just two key points that I believe and were communicated to me by the UK Aid to really make sure that I mention is that one, UKAID is pleased with the collaboration and working together with the Ministry of Health and also the NCPD. I think they've been participating in the advocacy teams at NCPD level, looking at domestic financing for family planning. And some of the contribution, of course, is funding of the program that I've just mentioned that is implemented by Population Services Kenya with other partners. And the key interest the UKAID would like to put across is to see the progressive, sustainable domestic financing for family planning. And I just want to say again that there is goodwill, there is commitment that has been demonstrated by the government towards that front and was well addressed. I think the other area is the issue of policy environment that supports the already made gains, because we cannot say we have not made progress. We've actually made a lot of good progress in Kenya in family planning and help the country to continue making the progress towards addressing the unmet needs for family planning that we all know, despite the good work, we still have a big gap in this country. So thank you very much. Yeah.
Thank you so much, Dr. Josephine. Our chief guest at this point in time, I wish to remind ourselves that sometimes last year in November, we held the ICPD 25. And it's almost the first anniversary towards that. And I wish to recognize that UNFPA, the government of Kenya and the government of Denmark, played a big role towards the success of the summit and several other governments in the world. So I said this because I'm about to invite Dr. Aziz, who is representing the UNFPA country rep, Dr. Demola Olajide, to give his brief remarks. Dr. Aziz, welcome.
Thanks a lot, sir. Dear chief guest, I will try pronounce names rightly, but if something wrong, please forgive me. Dr. Mercy Mwangani, dear Dr. Pacifica Onyancha, dear Lucy Kimondo, NCPD, I hope I may pronounce well, and also dear Dr. Caroline Guna, representing Dr. Kibara, our friend, Director of Health, Nairobi Metropolitan, Dr. Isaac Bashir, brother, and Dr. Josephine Biungu, Biui, UK8 and DFID, yeah, former. And ladies and gentlemen, and our king and queen, welcome. As I told, today is your days. You should not be calm. So, first of all, you know, it is great pleasure to see all of you, because endless virtual meetings are taking out some emotions. But today we can a little bit be emotional, smile to each other and joke to each other, and particularly when we are talking on World Contraceptive Day, because this is very important, and already my friend is told about importance of that celebration. And this is great pleasure for me, not only representing Dr. Demola, but whole UNFPA team in Kenya and whole UNFPA, because UNFPA is a global organization, and we are everywhere today supporting governments and working with our partners in order, one more time, to pass message how it is important to have sustainable family planning programs in the countries. So first of all, I want one more time underline how government of Kenya is putting family planning as the central pillar of reproductive health and wider national health priorities. All of them are outlined in Kenya Health Sector Strategic and Investment Plan, Kenya Health Sector Policy, and Kenya Vision 2030. When it was celebrated 10 years of Constitution, I went to Constitution. Now I am also Kenyan, and I found that Article 43 of Constitution is also implying to the family planning, because there is clearly written right to health, including reproductive health. And family planning is, of course, main pillar of reproductive health. And here I also want to underline that Kenya made significant progress in this area last 15 years. Yes, we have Kenya Demographic Health Survey, only last one is 24, but based on that, we can look that contraceptive prevalence rate in 2003 was only 39, then 2014, we reached it here 58%. This is significant progress. Also, if we look at unmet need, that was 28 in 1998, which is then declined by 18% in 2014. And government continuously supporting the population program in the country, and this is enabled development to people-centric in the spirit of International Conference on Population and Development. We are everywhere saying ICPD. And it is already mentioned here that last year we had here Nairobi Summit, ICPD 25, and now, even in my country, when I am going to my village, all of them know about Nairobi because of Nairobi Summit. And Kenya's commitment is, that time was done by high level, His Excellency, and 17 national commitments, and all of them are around achieving universal health coverage, ending gender-based violence, female genital mutilation, and other harmful practices against women and girls, ending the unmet need for family planning. These commitments also aim at ensuring availability and accessibility of high-quality data for the decision-making. So decision-making should be done informed based on the reliable data and evidence, and that is at all levels, and based on that data we can also look at where we are with the unmet need of family planning. All of us know that how globally COVID-19 pandemic has created disruptions on global supply chain of health commodities with severe implication on access of life-saving sexual reproductive health services, leaving many women and girls of reproductive age exposed to unwanted pregnancies. I wish to applaud the leadership of the Minister of Health in ensuring continued access and availability family planning services to the last mile, even during the COVID-19 pandemic. And that's why I also agree today's theme is very important. Unfpa is key partner to the government of Kenya in reproductive health commodity security, which is key in delivering sexual reproductive health information and services to the last mile. Women's and adolescent girls' access to sexual reproductive health information and services is not only health issue, and you, Josephine, already underlined it. When we are talking about family planning, we should not just say about impact to health, but we should go a little bit out of health issues. For example, for girls, family planning gives them continue their education. For women, gives that they can join to the labor force and economically be empowerment and also contribute to the economical growth of Kenya, and other issues, what you already, Josephine, underlined about poverty issues and others. And this is a cheaper way how we can go to the 2030 Sustainable Development Goals. Unfpa mobilized resources to support the government to provide family planning commodities by collaborating with Ministry of Health, other stakeholders, to ensure there is continuity of sexual and reproductive health services during, and we hope will be there after COVID-19 pandemic. And we are, this event showing how we are very seriously, comprehensively looking at these issues. I am glad to inform you that DFID, being a key donor to Unfpa on reproductive health commodity security, has supported Ministry of Health through Unfpa to procure labor plant implants. Cost of this supply is 1.3 million USD, and these commodities are arriving tomorrow to Mombasa. So, as a celebration of this World Contraception Day. And when we are talking about 1.3 million USD, what is the impact of this supply? So, based on special tool, we look at that estimated impact of this supply. Estimated impact of this supply is prevention of over 175,000 unintended pregnancies and nearly 500 preventable maternal deaths will be avoided, and also there will be avoided 40,000 unsafe abortions. All of them will be happen if we will reach to the last mile and give to our beneficiaries over 3 years. If we say about Unfpa, then Unfpa in 2019 and 2020 supported Ministry of Health's request to procure contraceptives with cost 4.8 million USD and 3.1 million USD respectively. So in total, it will be 5.9 million USD. Again, let's look at it not on the cash perspective, but also what will be estimated impact from that supply. So it will be prevention of over than 1.5 million unintended pregnancies if we will use these commodities with good quality. And nearly 1,500 preventable maternal deaths will be prevented. And also, these commodities will help us to avoid around 900,000 unsafe abortions over the next 3 years. So impact is huge. And then we should be sure that, yes, we are procuring it, we are importing it into the country, and it should go to the last mile, and beneficiaries are using it. So there are a lot of issues even after, having funders. At the conclusion, I want to draw your attention, as already here also in the theme indicated, that family planning as intervention for saving lives, as well as attaining the demographic dividend. Therefore, one more time I appeal to government to ensure that family planning commodities are adequately budgeted, funded at the national as well as county levels. We must strengthen our supply chain system. And COVID-19, bad things sometimes is also opening other issues. And now, being in Kenya, I saw a lot of advantages of technologies in Kenya, which then now can help us to improve supply chain management and be confident on our data, how we are providing, serving women and girls. And taking this opportunity, I want one more time underline that first anniversary of Nairobi Summit is approaching. It is next to our door. So it means we should critically look at our achievements and in particular our weaknesses. And we should strengthen our multi-sectoral approach to family planning, and we should involve all partners, particularly private sector, non-governmental organizations, civic organizations, and beneficiaries, king and queen, through whom we can provide right information. And also our people should know where they can get services. Sometimes this is also confusing. We have everything, but if beneficiaries not aware where they can get what kind of services, that is also raising issue. So one more time, I want to underline that family planning saving lives. Here we don't need any debate. If it is saving lives, and if it is contributing to the country's development to achieve 2030 sustainable development goals, it means we should work together. So, asanteni sana. All the best. Thanks.
Thank you, Dr. Aziz. You know, sometimes we also don't pronounce your name well. So as you live in the country, you'll know how to twist your tongue a little, make it a little lighter and heavy where need be, and you'll be good to go. Thank you. Now, Chief Guest, allow me to invite Dr. Pacifica Onyancha, the Acting Director of Medical Services and Preventive and Promotive Health, also representing Dr. Amoth, the Director General for Health at the Ministry of Health. Dr. Onyancha.
Thank you so much, MC, for inviting me at this moment. Our chief guest, Dr. Mercy Mwangangi, the Chief Administrative Secretary, Ministry of Health, representatives from the various constituencies present, ladies and gentlemen, good morning. I'm very delighted to stand here as the head of the directorate where issues family planning are, and also representing our Acting Director General, Dr. Amoth, Patrick Amoth, who was not able to come and has really sent his apologies, and I believe that you'll be able to agree. So I'll be able to make remarks on behalf of our Director General, and of course, as the head of the Directorate of Preventive and Promotive Health. Allow me to start on my own as the Director that it was last year that a presentation was made by our partners, and thank you so much for opening my eyes when I was actually in the ministry, having been appointed in that part of as the acting director, where I saw a presentation that really opened my eyes as far as family planning is concerned. That is what Dr. Aziz was referring to, that the impact of actually family planning. Many at times we tend to think it is only spacing the children. That is the concept that many of us have. But when I saw that presentation, it really showed me, and I was so shocked, and I became a champion of family planning because it means a lot. We never talk about when you don't actually space your children or get pregnancies when you need it, the amount of impact it has on women and even the children, the unborn and the born. So it is important that even as we celebrate this very important day, that the world realizes that it's important for us to remind ourselves the importance of family planning, that you can be able to actually look at it and indeed understand the role of contraceptive in terms of wanting, getting pregnancies when you want it. So allow me to actually give these remarks on behalf of the Director General, that today, the 26th of September, we mark the World Contraceptive Day, an important day in the calendar of global health campaigns, with a theme that is very simple today, as you can see, sustaining family planning services during the COVID-19. And because this is really a worldwide pandemic, so each one of us, as we celebrate in Kenya, I think this is something very, very appropriate all over the world. So the annual worldwide campaign centers around a vision where every pregnancy is wanted. It was launched in 2007, and the World Contraceptive mission is to improve awareness of contraceptive and to enable people to make informed choices on their sexual and reproductive health, of course bearing in mind their health in term and that of the children. As we mark this day, we also celebrate progress we have made as a country because to deliberate and focus efforts towards expanding access to contraceptive options. This has provided women with opportunities to make decisions that protect their health and well-being so that they can live up to their full potential, and the government of Kenya recognizes that and has really invested in family planning, as we will be able to see. Kenya Demographic Health Survey of 2014 reported a dramatic increase of use of modern contraceptives among married women and during the 5 years, whereby it increased from 32% in 2003 to 39% in 2008-2009 financial year to 53% in the year 2014. That is really a tremendous, and indeed it tells us that we have actually realized the need. Just the way I was converted by a presentation, even as a country, we know what it means to actually invest in family planning. So the performance monitoring and accountability data of 2020 indicates that MCRPS continues to increase, now standing at 60% among married women of reproductive age. So the percentage of demand satisfied by women modern methods increased from 64% in 2008-2009 year, from 71 to 71% in 2014 among the currently married women. So such figures, because they don't lie, indicates that indeed we are in the right direction, and we can celebrate with a smile today, this particular contraceptive day. Looking at the pandemic 2019, as it is part of our theme today, the COVID-19 pandemic has caused a tremendous uphill in the health systems around the world, of course disrupting access to family planning information and services, as well as sexual and reproductive health generally. Despite this disruption, the need for family planning remains the same. For women in Kenya, family planning is critical and is actually seen as a basic health care. And as such, the health system shift to include preventive and the treatment of COVID-19 is taken in turn together with the family planning. We are aware, for those who have been responding to the COVID-19, that we have a committee on maintaining essential health services, and family planning is part of that essential services. Of course, we had to move with the speed to halt the downward trend because of the COVID. And I'm glad to note that that's the committee I chair, and we are able to celebrate and smile that indeed the services are actually coming up because of the interventions that actually was given. So to ensure these essential services continue, the Ministry of Health in April 2020 developed and disseminated the Kenya COVID-19 Reproductive, Maternal and Neonatal Health Guidelines, which recommended the prioritization of methods that minimize contact between clients and healthcare workers. And consequently, when the family planning commodity uptake by women of reproductive age, statistics was compared from January to July for 2019 and 2020, it was shown that uptake of family planning services declines for IUCDC, implants, for unilateral surgical contraceptives, all methods that require prolonged close, but then this has actually been seen to be reversing now. So financing for family planning services, ladies and gentlemen, it is good to note that Kenya has reached middle income status, and indeed that is what Dr. Bashir talked about. We had to sit with our development partners and come out with a very clear roadmap of transition, whereby we were actually to have a ratio, and I was part of that team. And indeed, I am glad to note that the government of Kenya honored its commitment, and our partners honored that, and therefore we are in the right track. We are in 2019, as I've already said, we agreed on a way of transitioning so that we can ensure 100% financing for family planning commodities by the year 2023. And I can confidently say, and that's why I sent Dr. Bashir to be in the MTEP process to make sure that 2024 we are buying the commodities of family planning 100% as a country. And our chief guest, I believe that is where he's coming from, because he knows he's there so that he doesn't fail, that he really asking for your hand in this, that indeed we be self-sustaining as a low middle income country. Furthermore, in the year 2019-2020, the government committed to increase the portion of the national health budget for family planning. And indeed, we are glad to note that that is exactly what happened. So Kenya has signed many commitments globally and regionally and invested heavily on plans, strategies, and policies, all of which ultimately intend to expand not only access, but the number of contraceptive options available to the women. To sustain the gains with much better results, we need to focus on the following key things which I want to note. Number one, applying a multi-sectoral approach to family planning given its known impact in our nation's economic growth, and I'm glad to know that we are here to actually just say that. Number two, special focus on education, because it has been demonstrated that indeed education itself gives women to make choices and decide for themselves. Increase financing for health at the national and county levels with a dedicated line budget for family planning. Number four, coordinate the contribution of development partners to tap into the benefits of the devolution. Number five, focus on inequalities. There are several counties in which high fertility and low family planning are still existing, and I think this one we have to do that so that we need to ensure that no one is left behind. Six, laying a solid foundation for the next 50 years that ensures universal access to family planning, and as a key pillar with universal health coverage. And indeed, it's good to know that in the UHC package, the benefit package, family planning is part of it. Finally, innovate to take advantage of technology to accelerate access to quality family planning services and information to all citizens. Ladies and gentlemen, just to emphasize, we must continue to seek better ways to address the family planning needs of the poorest and the hardest to reach segments of the population. And to that end, we must remain committed to ensuring that access of family planning is never a barrier for improving women's health, given we all agree that this is a cost-effective investment. To provide an enabling policy environment, the Ministry of Health has developed various policies and guidelines to assist in investing, planning, and service delivery. And therefore, the government further commits to working with all of you as partners to ensure universal access to family planning in respect of the full right to health, and particularly reproductive health for all citizens as enshrined in the Constitution. In the same breath, the government requests you and all of us, our valued partners, to renew up your commitments to the family planning program in support of the government's effort to ensure accessibility to quality family planning services, commodities, and supplies of all women in our nation when and where it's needed. Finally, I am aware that various counties will also be observing this important day through planned activities culminating in offering family planning services to our clients. This is indeed commendable, and we look forward to continually collaborate in not only commemoration, but to actually act when we are needed. May God bless you.
Thank you so much, Dr. Onyancha, for representing Dr. Amoth and speaking on your own behalf. That was quite insightful and informative speech that you gave to us today. At this point in time, our chief guests, allow me to invite the representative for the Director General of the National Council for Population and Development, Madam Lucy Kimondo, to give his remarks. As she comes, our chief guest, we appreciate we are in tough times of COVID-19, so our function may not take so long, so that we do not break the rules that we have set ourselves as government. Thank you, Lucy.
Our chief guest, Dr. Mercy Mwangangi, Dr. Pacifica Onyancha, representing the Acting Director General, Dr. Bachil, Head of Family Health, Dr. Aziz, representing the country representative Unfpa, members of the press, senior government officials present, development partners present, all protocols observed. I am standing here on behalf of Dr. Sheikh Mohammed, who couldn't join us. He had traveled out of Nairobi, so he was unable to join us today. So I'll read his speech. It gives me great pleasure to be here as we celebrate the World Contraception Day. Family planning in Kenya has seen great strides as more women access services. We all remember in 2012, during the London Summit on Family Planning, Kenya made financial commitment to secure increased domestic financing for family planning commodities, and we have kept that promise. Also, in November last year, His Excellency the President led the country in making 17 commitments, and one of the commitments was for the country to gradually increase funding for family planning services, and including commodities from our own resources, that is from our own budget. Ladies and gentlemen, the ICPD 25 commitment galvanizes all of us to ensure that everyone in need, I'm including men in this, in need of family planning can get them irrespective of their social status. NCPD is committed to intensify the advocacy to ensure that family planning funding is guaranteed. It is important for Kenya to increase domestic financing, taking into cognizance that we are now a lower middle income country and not that of a priority for funding from the development partners. I know I'm talking to the converted, but I know there are those who are at home. Family planning is a development issue. For a woman to fully participate in economic development, for her to be in that kiosk that she needs to set up, for her to participate in the shama that she needs to plan her family. Why does she need to do this? So that the family can have the nutrition, she can plan for the nutrition for every child, she can plan for the education for her children, and hence ensuring that we break the cycle of poverty. Family planning availability ensures that everyone, irrespective of whether they are in the border, that is at Nadapal, or at Horohoro border point, they can actually access the services, so that it's not only in urban areas. We are all aware that the government of Kenya introduced a budget line for procurement of family planning commodities in the year 2004-05. The amount allocated for the family planning commodities increased gradually up to the year 2012-2013. We sort of went down, but we are getting there when devolution came. But now we have found our footing, and we have to recognize the health workers who are actually in a position to offer a comprehensive range of methods to ensure that the demand for contraception is met by those who require these services. It is important to note that overall expenditure of procurement has not always matched the resources that we have, and that is why we always appeal to the partners to fund us. But as the country promised, and as Dr. Onyancha has alluded to, we plan to fund our own commodities by 2023-2024. NCPD will continue providing the advocacy efforts and creating awareness to ensure the demand. I also wish to inform you that in 2012, that is when we developed the population policy for national development, which set targets for family planning, and we have actually achieved that. That is why, starting this year, we are revising the national population policy to have the new goals that the country will meet. We also we have also had our census, that is last year, and our population patterns have changed. And we know that we are growing at 2.2%. So we want to include the challenges that we are having posed by the demographic, the epidemiological, we are all knowing that we are in a pandemic, nutrition, and also the movement, that is what we call the mobility transition. We also want to include the emerging opportunities that are presented by the population dynamics. That is including the demographic dividend. And as you look at the country, you can actually see that it is urbanizing very fast. Then we also want to strengthen the integration of population. When we talk family planning, many of us think of it's a health issue. But studies have shown that investing for 1 shilling in family planning, you actually save 4 shillings. So if Kenya we were to include, we wouldn't be crying that we are having a deficiency in the budget. So as we revise this policy, we will be coming to you for your inputs. And as I conclude, I wish to reiterate that NCPD is committed to advocate for family planning, for resources for family planning, and also to create awareness so that the demand for services are there as we march towards a sustainable domestic financing for family planning in Kenya. Thank you.
Thank you very much, Madam Lucy Kimondo, for those quiet remarks. At this point in time now, we are getting to almost the tail end of our program. Our chief guest, allow me to invite Dr. Onyancha to welcome the chief guest. Thank you, Dr. Onyancha. Karibu.
Thank you once again, MC, and allow me to take this opportunity to appreciate Dr. Mercy Mwangangi in a very special way, not just for today. She has been very handy, our Chief Administrative Secretary. Remember, we were just the other day, you came in handy in the 3rd National Nutrition Symposium, where we were with you when I was virtually, and the technology sometimes fails us, and you patiently waited. And today you are here, being a Saturday, I know you could have done so much. Because this is the day we have at least to even us to remove cobwebs where we live and all that. And so I really want to appreciate that you are able to get time to come and speak to us. We cannot take it for granted. And it is my pleasure to welcome you to come and give us your wise words in this particular day as we represent. Can we all stand as she comes? Until she comes, until she comes, until she comes, until she starts.
Thank you so much. Thank you so much, Dr. Onyancha, for those kind words. And indeed, if I invited you all for lunch today, you'd see the many cobwebs I have where I live. That is true. That is true. And so, yes, I shall try and keep it brief so that we can all go and clean, those cobwebs up. I would like to begin by really appreciating each and every one of you for making time today to be with us. A quick review in the room, I can see at least we have 50 people here, thereabouts, and we're all socially distanced. That's important for me to note. And really to thank you for taking time out of your busy schedules to be here today. Special appreciation to Dr. Aziz, who really has been a thought leader and a partner in the Ministry of Health and has supported not only the family planning agenda, but numerous other activities that are so essential, to the ministry, to UHC, and advancing our health objectives. And then perhaps a special also appreciation to really the team from the Ministry of Health. When you see them here, these are the true champions of family planning. Just last week, as Dr. Onyancha has said, she was able to tell me that Bashir was in Naivasha bargaining and ensuring that there will be sourcing for family planning activities, amongst other activities. And really you can see when an officer is that dedicated, when it becomes a personal cause and initiative, then really we stand to gain. Noting again also Dr. Kaliti, who really this year has taught me many nuances about reproductive health, things that I was not aware of. He's always there, particularly when we have to address key issues with parliamentary bodies. I thank you for that. And then our partners here today, DFID, who are here, should I say by proxy through their implementing agencies. Again, thanking them for the support. I do remember last year, DFID was part of the team that was really pushing us hard to ensure that we invested in family planning commodities. And really, look, it has borne fruit. And I'm made aware we actually have put, our mouth where the money is, or what is the saying, money where the mouth is, and investing into family planning activities. So thank you all. Before I get into, my formal speech, which is a speech that was to be made by the Cabinet Secretary, C.S. Mutahi Kagwe, he too extends his appreciation to all team members present here today. He actually is what I call perhaps feminist #1 when it comes to advocating and creating spaces for all of us. And really, this is a cause that is dear to his heart. And so he really thanks you for making time. He has given us blessings to be able to relay his message to you today in terms of what we foresee as government and as the Ministry of Health when it comes to commitment on family planning. Now, while I was preparing for this session today, in true nature, because I enjoy reading, I did a bit of reading, and I wanted to go way back when, turn the wheel, before COVID, perhaps. For me, this year has been 10 years in 6 months, but before COVID, let's go a little bit back to when it all began. And I was able to see when the 20th century came about, if you've all heard of suffrage. Who has heard of suffrage here? Who knows what suffrage is? These are the first, should I say, activists of family planning way back when, 20th century. Women and men who are advocating to ensure that, there's opportunities for women to be able to have good work experiences, opportunities for women to be able to advance their education, opportunities also for women to be able to actually actively participate in a family setting while reducing their burden. And these women coined a term known as the Reproductive Revolution. And I know we've talked of many revolutions, but if you look back in reading, you'll see 20th century began what was known as a reproductive revolution. And the author of this piece was really reflecting, what have we been able to gain 30 years to where we are today? What have we been able to gain a century to where we are today? And really, as Aziz was talking, I do remember last year being part of the team that was in the background, planning and preparing the leadership for ICPD. And I think that perhaps was one of the most monumental gains that we've made, perhaps as a country, before we reflect on Africa and the world. And last year, if you remember, the president, again, really focused this as one of his key agendas. Many of you may not be aware, but our president is actually celebrated the world over for advancing women's rights and advancing a lot of policy initiatives and investments when it comes to women. I do remember, in fact, last year in Vancouver, he was able to receive, some recognition for his work and his commitment. And even in terms of hosting the ICPD, if you all remember, it was quite an interesting week of a lot of activity and a lot of, sometimes controversial issues coming up. But then the country was able to really surmount all those challenges and refocus the message back to, at the end of the day, this truly is about the woman, right? This is truly about the economic development of our country. And again, in reflecting to be here today with you, I was able to again go way back to 10 years ago when I was a medical officer practicing in Machakos Level 5. And I do remember particularly having to, engage with numerous women during my labor ward, gynae rotations. And one of the interesting things was that some of the mothers that we lost are those mothers who we would call para 7+1. Who knows what a para 7+1 means? Who knows? Like, who really appreciates what that means for that mother? And I do remember, being a very, nervous intern going in for a cesarean section of a para 5+ something and being extremely worried about that uterus. How will the uterus respond when you're cutting into it to try and, deliver the baby? And, you'd reflect and wonder, and the woman, was not exactly, celebrating her new parity status. She was not exactly enthusiastic. This was, you could actually see in her posture, in her walking, in her engagement with us, that this was yet another, load on her workload when it comes to her being a mother, when it comes to her being an active citizen. And really, what would have prevented that? It's what we are discussing today, right? It's family planning, ensuring that these products are actually, one, available in the country, but two, also accessible to this mother. And I can tell you, we did have some poor outcomes with some of those para 7+1 mothers, whereby you would be there struggling, and you'd either lose a mother, or sometimes have to go ahead and have a total hysterectomy thereafter, because you know what the ill effects will be for the next pregnancy. And that is serious. And that happens perhaps beyond Nairobi, beyond this hall where we are, into the country and the counties. There are many women experiencing this. And that's why it's extremely important that we're here today, and I'm sure these women would really appreciate and are leaning on you to further and ensure that these products are available for them. And so as we discuss availability, Dr. Aziz mentioned that it's one thing to have the things here, and we have them, and and Bashir is working very hard to ensure through the MTEF process, we have them here. But then when I was seated there, I thought, okay, let's see. Let me try and see where I can get this service if I needed it. I don't know if you all have a phone in front of you. One of the easiest things I can get you right now is perhaps a bottle of gin or Tusker, because we know these people deliver very quickly, right? Right? You can always dial a beer, you can always dial a gin. I recently discovered you can dial nyama choma, it can come to you. You don't have to go to it anymore. Now try and Google family planning service near me. Just go ahead, just try on your phones and see what will come up. Yet we are all here today as the duty bearers of family planning services. We have government here represented, we have partners here represented, yet I can easily dial a beer. But if you look at family planning service near me, what comes up? The Family Planning Association. That's an institution. That's the first thing that's coming up. The second thing, of course, is a very able partner who has availed these resources. When I looked at that list, I was actually embarrassed. As duty bearer in government, there is no public health facility that's coming up. Yet where are we right now? We're in Pan-Afric. Let's look at the radius. We have State House Dispensary there. We have Lady Northie. We have KNH. We have Mbagathi. We have many public facilities, but nothing near here. Now, do you want to try and see Google Tusker near me? Do you want to see if that will come up? Because I'm sure that will definitely come up and it will be easier to get. So perhaps even as we discuss, availability of these commodities, we also need to start thinking about ways of making them truly accessible. Truly accessible. And that simple exercise, we could have done it here in the room and we've done it, but I can tell you, there are girls out there who are doing this, who are on their phones trying to figure out, okay, if I need this service, where can I get it? Kenya, we always say, has immense mobile, penetration. Yet, we've, almost taken it away from Kenyans to be able to access it. So this is just sort of a call to action for the people who are here in the room, because you're the ones who are driving this agenda. NCPD, it's about time we GIS mapped facilities that have FP and that they're available, and that I can go and dial my Tusker as I get my implant as well, right? That's important. Now, perhaps then, what I'll do is that I will get into the speech that was prepared by the team, and this is the speech that was, approved by our CS in terms of our commitment, in government when it comes to family planning activities. And I do take recognition of the theme today, ensuring the continuity of family planning services in the wake of the COVID-19 pandemic, while accelerating sustainable domestic financing for family planning. So the World Contraceptive Day is an annual global campaign that has been in place since the year 2007 with the aim of raising awareness about scientific advances in contraception tailored to enable couples to make informed decisions regarding starting a family and achieving their desired family size. It is an important day to lead the country in taking stock of our progress as a nation, in empowering families to manage and realize their fertility desires. The government is committed to providing quality family planning services by providing 1, an enabling environment, 2, quality safe contraceptives, 3, setting the relevant standards, and 4, ensuring that we are regularly monitoring and reflecting on progress of this. The Constitution of Kenya 2010 recognizes reproductive health as a right and family planning as a key component of ensuring a quality and fulfilling reproductive health life for all Kenyans. Kenya, led by our President, His Excellency Uhuru Kenyatta, last year commemorated the ICPD 25, where commitments were made on accelerating the realization of the SDG goals by 2030, and most particularly the SDG goal 3.7 that touches on universal access to reproductive health care services. And of course, this includes family planning services. And that is why we are here today to mark this day, to continue raising awareness and to sustain momentum towards this objective. We are comforted as a ministry today that as we mark this important day in the calendar of events, that Kenya has made outstanding progress in increasing access to safe, quality, modern methods of family planning. We do take note, and all speakers today have really celebrated that we've been able to make certain gains when it comes to our indicators, moving from 36% of married women using modern family planning methods at the launch of this day in 2007, to now a current regional high of 62% of married women in Kenya using a modern method of managing family planning. We too take note that there is increased success, there is increased use of quality safe methods of fertility management, and with this we have reported gains. We can see that in Kenya, the total number of births per woman in Kenya has declined from a high of 4.8 births at the start of this campaign in 2007 to the current regional lowest low of 3.4 births per woman. And the government continues, therefore, to be responsive to the needs of Kenyans, and specifically in ensuring that we deal with the unmet need. We do take note that this unmet need has been able to be narrowed, the gap of this has been narrowed, and we continue to make investments towards this. And perhaps it becomes also important to note right now, as the world faces a global COVID-19 pandemic, that we must ensure that there is continuity of health services, and most particularly family planning services. And again, I take recognition of efforts that have been underway in the ministry through Dr. Onyancha and the team of different partners. They've been able to really do a lot of work when it comes to assessing what was the effect of COVID-19 when it comes to continuity of care. But then now they're in the second step of ensuring, so what do we do then? Now that we know there was this impact, how do we ensure that we actually close the gap and get back on track with our targets? And so we do thank you all really for your continued commitment. And really the theme of today then is more apt in terms of it speaking to ensuring continuity of family planning services in the wake of COVID-19. I do also take note of what many speakers have talked about today when it comes to the economic impact and the other non-health impacts of family planning. We do take note that Kenya has been graduated as a country when it comes to its income status. And this transition essentially means that more developed economies, who over the years have been granting us resources to finance key sectors, will now be seeking to ensure that we move towards domestic resource mobilization. And therefore, that is absolutely crucial, the shift to relying on domestic resources to close the emerging gap. And therefore, really, again, resounding with our theme today of ensuring sustainability. In the ministry, we're informed that Kenya, and this includes both public and private resources, spends about 7 billion annually on family planning services, of which we have expenditure footed part by government and part by partners. And we do recognize that more needs to be done in ensuring that more resources are invested in this space, and not only in the family planning space, but generally in the health sector, so that we can be able to meet our UHC gaps. And so with this realization, government continues to ensure that resourcing is mobilized. There is a contribution, I'm told, this year of 800 million Kenya shillings that is towards direct purchase of contraceptives for the public. And we continue to ensure that we shall increase on this resourcing and ensure that gaps are met. We thank you all really for being here. Thank you all for paying attention and for really, listening and championing and being champions on this weekend for family planning services. And so I do declare perhaps this World Contraceptive Day 2020 open. Let us continue to advocate for this very crucial agenda for our women and girls. It is very, very vital and very, very important. Thank you all.
Thank you so much, Dr. Mwangangi, for that speech that you've given us and the remarks that you've given us. Allow me now, as I have been requested, to move a vote of thanks. First, allow me to appreciate our chief guest today, Dr. Mercy Mwangangi, for getting your time over the weekend to be with us. We know you've been quite busy with the Covid-19, and we really appreciate that you got time to be here. I also wish to thank the Minister of Health, the various heads of departments who have been here and worked hard to ensure that this day becomes a success. I also wish to appreciate the entire national government, the National Council for Population Development, with all the partners, including Unfpa, UKAID, PSI, and the rest of us for making this day a success. I also wish to recognize and appreciate our brother and sister there, I'm told, is a king. Actually, this is the first time I'm meeting you. Is a king, is a king and the queen. You can see what they are wearing, the king and the queen of that. We thank you for getting time to be with us on this day. I also wish to extend our sincere thanks to the Nairobi Metropolitan Services Directorate of Health, Dr. Josephine, represented by Dr. Gunu, for making time to be with us here today. And finally, and not the least, we appreciate the Fourth Estate, the media, for the role that you play in information, education, and communication, so that we educate our population on the issues that we all yearn to deliver. Finally, I appreciate Pan-Africa Hotel, the management, for this venue and for the serenity that we have. And lastly, not the least, the Most High God, for enabling us to be here and to be healthy. And with those few remarks, our chief guest, I wish to invite all of us for lunch, not a brief lunch, for lunch, so that at least we replenish ourselves and the levels of sugar go high. So with those few remarks, am I supposed to declare it closed? Do I have the powers? It's not closed, so the ceremony continues, and we may all leave at our pleasure. Thank you so much, and have a good weekend. Asanteni sana. Thank you. Yes, prayers. I can't forget prayers. I volunteer this time around to lead us in a word of prayer. I'd also pray for the lunch. If you don't volunteer, I'll call you. At least I know quite a number of you. Dr. Gunu, can you lead us in a word of prayer? Thank you, Dr.
Let's bow our heads and pray. Dear Heavenly Father, we want to thank you for this opportunity to be here, oh God, today as we celebrate the World Contraceptive Day. We want to thank for each one and every individual who has been able to participate. We want to thank you for our guests, for the leadership that we've gotten from the ministry and the support from the partners. Lord, as we depart, today we just ask that you be with us, help us and guide us even as we play our role in nation building, even as we move forward. Father, we ask for the strength to be able to work hard to ensure that all women in Kenya access their right to health. As we go for a meal, we ask that you bless it. We pray all this, trusting and believing in your holy name. Amen.
Thank you. Final announcement, I'm told, for the lunch. We are going to serve downstairs, but for the chief guest, we will be guided accordingly. Thank you.